So it is basically using fillers and or threads to try and modify the appearance of the nose. So the most common area that is treated with non-surgical rhinoplasty is the dorsum of the nose, that is the bridge of the nose. So that is especially common in Asian noses where there is a lack of definition of the bridge. So you can do augmentation of the bridge. You can do only an augmentation of the radix. So if you have a hump, you try and fill up this, so you do an augmentation of the radix. You can do changes to the tip. You can do changes to the columella. So if there is a drooping tip, you can correct it, you can bring it up, you can use some fillers to try and camouflage or change the effect of how the nose looks. You can do the nasal base, which is basically, some people have a retruded base, so you can inject fillers here to bring the nose forward. You can do it for the columella to make the nose more upright. You can do it for the alar rims to try and make them more conical or more triangular. So there are a lot of changes that you can do along the nose, but all the changes involve adding things, not removing things. What exactly is used in non-surgical rhinoplasty? When you're doing a non-surgical rhinoplasty, you're going to be most commonly using fillers, and second is threads. So fillers are basically, you inject the filler and the initial effect is just by the filling effect, and as it starts degrading, it tends to induce collagen formation, and that can give you a longer lasting result. To augment this effect, you can also use threads. So especially for depressed noses, you can use threads along with fillers. So the fillers and the threads in conjunction, they act and promote more collagen deposition there and neocollagenesis, and that adds to the ultimate effect of an improve in soft tissue there, which will maybe stay longer and longer. Usually it lasts for about 6 months to a year. The fillers, if you add threads, it can be extended to a little longer. PLLA threads might be a little longer. Can reduction be done? So by definition, non-surgical rhinoplasty is using fillers to increase or to change the definition of the shape or the shape of the nose, but it doesn't, you cannot remove anything because if you have to remove anything, then you have to cut, then you have to do a surgery. So non-surgical, you cannot do a reduction. You can camouflage it. For example, if somebody has a hump and you want it camouflaged, then you can add filler on the top, you can add filler on the bottom, and then it becomes more straight instead of a hump nose. So yes, you can camouflage the nose, but you cannot reduce the size of the nose. So you can camouflage a hump, you can camouflage a depression, but you cannot actually reduce the size of the nose with a filler. What are the limitations of a non-surgical rhinoplasty? As I said, limitations, non-surgical rhinoplasty is basically you're injecting fillers or threads to improve the contours or the shape of the nose. So yes, you can't do everything with the fillers and the threads. Reduction, first and foremost, reductions are not possible. You cannot reduce that. So whatever you're doing is only going to be addition. So if you have a depressed nose, yes, you can add, but if you have a hump that needs to be removed, then you can't remove it. You can camouflage it. If you have a deformity post rhinoplasty, unevenness, yes, that you can do, but you cannot remove any deformity, or you cannot remove any cartilage or skin by a non-surgical, which is basically the definition of it. Another limitation is when you have to do a large augmentation. When you have a very depressed nose and you need to add a lot of volume to it, then that is not possible with fillers, because you need to put it in the right plane so that it doesn't shift and it doesn't move. And the more you're putting it in, then you have more chances of complications and more chances of skin issues as well. So that is why if you need a large reduction or a large augmentation, then it is better to do it surgically. So you need to identify what noses and what changes you can do with a non-surgical rhinoplasty, and that is why you need to go to somebody who has been doing it on a regular basis, so that you know whether you are able to achieve what you want with non-surgical or whether it is best to go in for a surgical procedure. Another question most people ask is it permanent? We don't do permanent fillers for the nose because the nose, as I said, if this is your nasal bone and this is your skin, so in between the skin and the nose nasal bone there are the envelope is very thin, which is only one layer of skin, a thin layer of muscle and some fat. So if you have any issues in that layer, like you put in a permanent filler and the permanent filler has issues, then you have to actually, to remove it, you have to actually cut and remove the tissue surrounding it along with the filler. When you do that, you're thinning out the envelope on top and you're causing more issues, because after that you can't do anything because you're going to be having issues. The skin is thin. Any problem that happens, then you're going to lose that skin on top. If you need something permanent to be done, then it is better that you go ahead and do a surgical procedure, and we can help you out with that, which is going to stay longer. And we try and avoid using sharp needles even for our fat grafting and for our filler. So we use blunt tipped cannulas. So the cannulas, because they are blunt tipped, by definition they don't enter a vessel, and that is why your complication rates are minimized. You don't have any major issues like embolism and because of the blunt needles. What are the complications? Yes, non-surgical rhinoplasty is not without complications, so it needs a lot of training. You need to go to people, because the whole nose and the face area, there are a lot of blood vessels which are surrounding the nose, and they form a thick, a large network around the nose. The most common or the dreaded complication that you can have by using fillers around the nose is something called a filler embolism. So there are a lot of vessels around the nose and the mouth which are in communication with the arteries and the vessels around the eyes. Sometimes if you don't look for a proper, and you're not trained, and you inject into a vessel, then that filler can migrate and go into the eye, and it can cause permanent blindness. It is a known complication. Second complication is if it goes into a vessel which is supplying one area, then the whole that area of skin, you might lose it. So that is another major complication. So these are the two main issues when you're injecting fillers around the nose. You need to go to a trained person so that they know what is to be done and they know how to handle the complication. If something like that happens, then they will be doing some massages. Then we'll be injecting something called hyaluronidase, which is basically a drug to try and dissolve the filler inside. But sometimes, yes, you might end up with a permanent blindness also, which is known to occur, and it has been reported in world literature. So that is one of the major complications. Apart from that, the other minor ones are usually lumps and bumps and unevenness, which all can be corrected over a period of time. Usually we call you after a week, and then we try and sort that out for you.